Aloha, and thank you for joining us for another episode of Financial Planning with Hawaii Central Federal Credit Union. I'm Amber Millsap, Community Relations Officer at Hawaii Central, and with me today I have Gary Yanagihara, who is the Executive Vice President of PSH Insurance, as well as Annie Karirao, who is a caregiver. And before we start, I want to ask Annie to tell us a little bit about herself and her experience and what brings you in today, Annie.
Well, actually, I'm here to learn more about the entire process overall. I actually was the sole caregiver for my husband for over a year, and he's recently passed. And in doing so, I have met many people, and in the process of the last 8 to 12 months, I'm really clear that one of the things that we did not do adequately well was the planning. And so I'm really looking forward to learning more from Gary this morning.
Well, thank you so much for joining us today, Annie. And just want to ask you, Gary, to tell us a little bit about yourself, about your practice, and what drives you.
What drives me? Okay. Well, I started my insurance career in 1976, and we founded PSH Insurance in 1982. So we're a locally owned and operated independent insurance agency, brokerage agency. And we developed our business based on education, but it's also woven with experience and knowledge. And we employ this thing called a hands-on approach to actually assist our clients. We have two distinct marketplaces, which is the commercial market, which we help companies with a spectrum of different types of employee benefits. And we also cater to individuals and offer them an array of individual life and health products.
Well, thank you so much for joining us today.
Pleasure.
And, last time we were together, we spoke about long-term care, but the initial and emotional impacts that everyone faces when they're faced with long-term care decisions. And today we're going to continue that discussion, but we're going to go a little bit more in depth with long-term care, right?
Yeah. I think the first thing we do is, if we can bring up that first slide, the question is, what is long-term care? So long-term care differs from other types of health care in that the goal is not to cure an illness, but to allow an individual to attain and maintain an optimal level of functioning. Long-term care involves a variety of services in different settings to meet a person's health or personal needs during a short or long period of time. The types of services that help people with health and personal needs and activities of daily living over a period of time would be determined if the care is given in a nursing home, assisted living, community care, or an adult daycare. And I think from Annie's experience being a caregiver, you may want to kind of tell some of the trials and tribulations you've encountered.
Well, it was really interesting because my husband's illness went from a protruding hernia to a prostate issue to urinary tract infections to pneumonia to having liver challenges and on, and then the continual urinary tract infection. In that process, we went from polymomy to Pro-Se nursing home to care in the home, back to Pro-Se nursing home, back out. And in the entire process, quite frankly, I was somewhat lost. And in the end, I couldn't even get him into a nursing home because he ended up being a male, and everybody was at their quota of males. So we ended up having to take care of him home, and then finding adequate services to be able to do that.
Right. Yeah.
So, Gary, you said that it's not to cure an illness. But so are we saying that once people enter into long-term care, that's it?
Yeah, usually the purpose of long-term care is really to maintain the level of their health issues or maintain their mobility. It's rarely seen that a person actually gets better, that they can resume what they're doing before. It's usually from there it kind of declines in the long run. So that's why long-term care, I guess the old definition for long-term care for people was you get into a nursing home, that's the next step is you're going to pass away. But that's not necessarily true nowadays because of medical technology. So you It's really to maintain the optimal level that they can still do things by themselves. And I think if we go to the next slide, it actually touches a little bit more, actually besides the level of care, but one of the things that I've always come across, or people have always asked me is long-term care only for older people? Well, the demographics kind of tend to sway that way, but actually long-term care is for everyone. Because it can be via an accident or an illness. There was a study done by Maryland University, and the highest users for long-term care was between the ages of 25 to 35.
Oh, really?
And that was really surprising, but when you look into the data, it said that those are the ages where people are willing to take risk. Speeding, hang gliding, bungee jumping, do those adrenaline types of activities, and the other ones could end up in a nursing facility and possibly be a resident or patient for a longer period of time. But really, approximately 70% of the people over age 65 will require long-term care services in some point in their life. Women have a higher risk than men, primarily because they live a lot longer. They're stronger than the guys, right? So what can we say? But according to the Administration of Aging Research, the average woman would need long-term care services for 3.7 years, and the average for men is about 2.2 years.
So when you say approximately 70%, that means what's happening with the other 30%? They're just
So they either
passing
pass
away.
away.
Okay.
But you notice that there's a lot of longevity. You see a lot of people in the 80s, 90s, and even hundreds, where before it was 65, and that was pretty much the max person would be alive. So things have changed because of medical technology, which is great.
How do you, I guess, handle a situation where someone is faced with the need for long-term care and they're just basically putting up roadblocks to that? You want to help. I think I kind of experienced this myself.
Sure.
But how common is that, and what are some tips for dealing with that? Because sometimes they might not have physical issues. They might have physical issues, but their mind is still
Sure.
there, right?
And that's the usual case. So it's a challenge. It's really a challenge because most people being incapacitated, so to speak, they still feel like they have control of things and they want to be independent. So even though family members, the doctor knows that they need care in a facility, they themselves say, I don't really need that. So it's a process you got between the family members and the physician, really, because if the physician illustrates to that patient what your spouse needs to do to care for you, then sometimes it works. Like I always say, when you're healthy, you think very logically, right? If this happens, we're going to do this. But when you become ill, logic is out the door. You want to do what you want to do. So that's the hard part. You got to kind of overcome.
For me, it kind of happened backwards, where I had pursued guardianship because my loved one was completely incapacitated in a coma.
Wow.
And so I had guardianship because we had no power of attorney in place. And then as she kind of got out of it, it was suddenly, I can take care of myself, but it wasn't clear what had happened during that coma, and we're not sure that mentally, she was even able to make
Right.
good decisions,
Correct, yeah.
because it had been so long in the coma, and they had projected that maybe she was even going to be, in a vegetative state when she got out of the coma. So, but she wasn't, but then it was still kind of like, wait, are you ready? And it was a struggle, but just wondering if you have any other tips.
No, it's a challenge for all families, and the idea for the family placing a loved one in a facility too, it's a challenge for them too, because they feel sort of guilty too, so it goes both ways. Not an easy decision, although sometimes it's a practical decision. So we all know about nursing home, and nursing home is a facility that it provides 24 hours of care. There's basically a physician that writes a plan of care, and of course after that, if you if you don't need 24 hours of care, you can go to an assisted living facility, which means it's a residential living arrangement, and it's not as intense as a nursing facility where you need 24/7. It's mainly designed so that you can do things yourself, but you still have to be supervised. But most of the people too, they would like to be in a community-based services, meaning that most people want to stay home to have care. I mean, that's kind of common.
Yep.
Familiar
Especially
surroundings, people, and so forth and so on. Although sometimes you may not have a caregiver, which like lucky your husband had, so they may have to go to a care home, which is probably a private home. They usually have 2 to 3 patients, or maybe up to 6, depending on their license. And it's similar to having a caregiver, except it's a person taking care of you as opposed to a family member. Each one has a different type of license.
Yep.
And they can either take 2 or 3 patients, some can take a skilled level of patients, some can only take custodial care of patients. So it's all over the place. So it's really important to ask the type of license that they have.
So when we're talking about care homes, how regulated are they?
So they all have to be licensed. That's number one. And again, depending on the level, they have a certain level of expertise to, especially if it's the skilled care, because at skilled care you had IVs, tube fed. So, and we find sometimes the retired nurses eventually open a care home because they're familiar with that and they want to, help their friends usually, and then eventually other people, the patients. And but it's also a business where you can charge anywhere from $5,000 to $9,000 a month per person too. So that's the other side, the
Well, a
business
lot
side.
of times you hear horror stories,
Oh, yeah.
And how I guess common is that with these care homes?
Yeah, it's not that common, but some of the red flags is, so let's say if you place somebody in a private care home, if they actually say you have to call us first before you can visit, that's a flag. Because it should be you can get see your parent at any
Anytime.
time, morning, noon, or night. So those are some of the things, and of course just a visual inspection of the place, cleanliness, and making sure that they usually have a plan of care, a schedule when they eat, if they do have rehabilitative services and so forth.
So your advice would just be to really check it out prior to putting your loved one there.
Yeah. It's not just the cost. It's more than just the cost. So,
So Annie, you were caring for your husband at home. Can you tell us a little bit more about that experience?
There are really no focused spousal support caregiving facilities. So it is really hard to be able to get help. So you can call a Bayada or a Prime Services, all these outside services, but even then you're waiting periods of time, and they can only send one person at one time, and depending on what their schedule is. So it's very, very restrictive in terms of being able to get help. So for me, and especially because I wanted, he wanted to be able to walk and sit up and things, to be able to figure out how to do it safely and all those kind of things was very difficult because you just couldn't find the resources. And then there are days where, quite honestly, for my husband, because he had to both be tube fed and I had to diaper change him and everything, part of the challenge was sometimes you just get so frustrated. He was so weak he couldn't even move, and I'm trying to lift him, and he's bigger than me, and there's nobody to talk to or vent or anything. So even some of these outside services, for me, they were like a relief center.
Right.
And then again, even if you go to a care home or a nursing home, even their visiting is restricted. You can only go at certain times, and so you just can't go any old time you want. So you have to be careful in terms of overall. And I did go to look at a couple of those residential care homes. And as soon as I walked in the kitchen, I was like, okay, that's it. We're not staying here. So, and you do have to look.
Yeah, you
because
have to
the intentions are great, and all these people do want to help. You get that immediately, but they themselves have different standards, and which all of us live by. And so they may have their license and do all the medical things right. That doesn't necessarily mean that everything within the parameter of like where the food is coming from is going to be exactly the same.
Right, right.
Yeah, so it's very different. So I really had a hard time, and one of the things that I've been pondering in my own mind for the last few months since his passing is, how do I help to alleviate that no support piece? Because there's hospice units, as you know, and there's a lot of support groups for if you're taking care of your children or you're taking care of your parents, and especially in Hawaii, a lot of us have taken care of our parents. And so there are a lot of support groups for that. But to get one that's only focused on a husband or a wife, that's hard to come by. And on top of that, when I went through this whole thing, I found out over 30% of the caregivers die before the patient. That's like, whoa, that's kind of scary business.
Well, I can't imagine you because you're so tiny, and diapering and lifting, it is heavy work. I went through a similar experience, and I remember, just dealing with major lower back pains, my back going out, and it is, I don't think a lot of us think about the physical nature of long-term care and just caregiving in general, whether it be long-term or short-term. But we can go to the next slide if you'd like to,
let's
Gary.
go to the next slide. So now we're talking about the levels of care. And I think we mentioned before, there's what they call skilled level. So it's daily nursing and rehabilitative care performed by and under the supervision of a skilled medical personnel. It's 24 hours a day, ordered by a physician, and they must follow a plan of care. You have custodial care, which is personal care. It's care to meet personal needs such as bathing, dressing, and eating. Home health care, it's services for occupational, physical, respiratory, speech therapy, or nursing care. And of course, the adult daycare, which provides it's provided during the day at a community-based center for adults who need assistance or supervision but do not need round-the-clock care. I think in any situation, being a caregiver, we kind of assume that if we hire someone, they're going to stay there 7 days a week.
No, it doesn't happen.
But it doesn't happen. So basically, maybe a nurse would come in once or twice a week for vitals. Then you may have a CNA coming in for hygiene, but it's never 7 days a week. It's always intermittent.
Yeah. And it's short periods of time.
Very
it's
short.
like half an hour, at the max an hour. And so it's like, oh, that's not a break time.
Yeah. So it's really hard on the caregiver. Very hard.
Yep. And the costs are very high.
It is, yeah.
I was like shocked at, oh my goodness. Wait, you want $700 to come for 4 hours? What? That's more than I make.
Could I ask you, you talked about these different levels of care, Gary. Is there like a progression sometimes where people might need at any one time all of those levels, or several different levels of care, not at once, but
Right.
kind of progress, or
Okay, so they usually start off in the hospital, so that's acute care. And then after the acute stage, they go to a skilled level of care. And sometimes that skilled level is still in that same hospital bed because there's no room to go to a nursing facility. And after that, then as long as you stay at that skill level, meaning that you still have to be what they call in a rehabilitative mode, you have to be continually getting better. If you're kind of plateaued out, then they remove you from a skilled to an intermediate or custodial level. And that's when you go out to another facility, whether an intermediate care facility, or you can have a care at home, or you could have community-based types of services. But it usually progresses to that. And after that point, it's just maintaining, really trying to keep that person comfortable. Yeah, that's the unfortunate part.
you touched on now availability. So what is the availability of long-term care services in Hawaii? Do you know anything about that?
Well, if you're talking about nursing facilities, we have a shortage. So like in Annie's case, she had to wait. And in most situations, that's why they have what they call a swing bed in the hospital. In other words, that acute bed can become a skilled bed if there's no room. And in essence, if let's say from the skilled, but they think they can go into a intermediate care, they immediately lower the level so that they can place that person to maybe an immediate care facility as opposed to a skilled care facility. But there is a shortage. There's just not enough facilities out there.
And I guess that's why we start seeing these in-home care services.
That's why so many
care
more of them
homes.
have come up. I actually was just so shocked almost about how many are there? And they're like, oh, hundreds. You just have to
Yeah.
go look. I'm
Yeah.
like, how do you find them? Because there's no central resource.
Right.
Oh, really?
Yeah.
No.
And then
So-
sometimes you can rely on home health care agencies.
Right. Or some of the social workers
Yeah,
at
social workers
some of the
too.
hospitals
Correct.
do sort of try to tap into, oh, so-and-so went here, try and call them. But again, there's no central piece.
So it's just by word of mouth almost.
Pretty much.
Yes.
Pretty much.
Oh, interesting.
A new business you can start. So we all have heard about costs being very expensive in a getting to a long-term care situation. So this is a survey that was done by Genworth in 2021, and these are average monthly incomes, and it also show the average annual cost. So nursing home, semi-private room, $12,000 and $12,500. A private room, $14,000. Assisted living is $53.75. Adult daycare is $16.25. Home health care aid is $57.20, and homemaker services is $57.20. Same amount. So this is what the average is in Hawaii. Now, again, it depends on the severity of the care needed. It could be more than that, or it could be less than that, right? So, and this is an article, June 14th of 1987, from Sylvia Porter. She had this article called "Your Money's Worth." And she said, if you're a typical older American, you face severe economic hardships when confronted with a long stay in a nursing home. The only Americans not exposed to this risk are either so wealthy that nursing home costs are inconsequential, or so impoverished that they already qualify for Medicaid or the welfare system. So I think we here, we're not that wealthy and we're not really Medicaid eligible, so we're right in that middle where it's going to cost us. So the question is, what do we do and how do we do it, and what are the options to do it with?
Well, I really thank both of you for being with us today. And before we close, I'd like to ask you, Gary, if you have anything else you'd like to share with our viewers at home.
Well, I think the most important thing is just to research long-term care in general. I mean, it is a problem financially and also emotionally. So it's really a good idea to plan now, just to talk between you and your spouse and eventually get your children involved, because they will be involved in the future.
And with that, I'd just like to thank everyone at home for joining us, as well as Olelo Community Media in the background doing what they do. And just say mahalo for joining us, and ahui ho.